All right, so today we're diving into some really powerful source material. It's titled The Lost Generation, and it confronts the drug abuse pandemic in South African townships. It's a heavy topic, for sure, but an incredibly important one that really deserves our full attention.
The document kicks off with this incredibly stark statement. Just 4 words. A generation is being lost. Wow. Let that sink in for a moment. It just cuts through all the noise, doesn't it? It reminds us that behind all the data and the analysis, we're talking about human lives, about potential, about futures that are just being erased.
And this quote from the source, it gets right to the heart of it. This isn't just one issue. It's more like a cascade of crises, one triggering the next. You have addiction, which fuels health problems. That in turn can lead to crime, and ultimately, the very fabric of society starts to break down. This is the devastating cycle we're going to unpack today.
So to even begin to think about fixing a problem this big, we first have to understand where it comes from, right? This next section breaks down the anatomy of the crisis, really looking at what's fueling this whole thing.
And that brings us to the big question. What are the root causes? You know, it's so easy to just point fingers at individuals. But what this source material makes crystal clear is that the reality is so much more complex. We're looking at a tangled web of social and economic factors, all feeding into each other.
So check this out. The source identifies 12 different root causes, and they're grouped here into 3 main areas. And you can see right away, none of these things exist in a vacuum. Under family and society, you see things like the absence of fathers. Then there's economic hardship. I mean, unemployment and poverty, that's huge. And finally, policy and health, where you see the impact of policy failures and even these deep generational wounds. It really is a perfect storm of systemic problems. Okay, so once the causes are laid out, the source then maps out the consequences. And it's this tragic but predictable ripple effect that doesn't just devastate individuals, it washes over entire communities. You can see it here. It's a clear domino effect. It all starts with addiction. That then leads directly to a whole range of severe health problems. From there, often out of sheer desperation, you see the next domino fall, a rise in crime. And the cumulative effect of all of this? Social disintegration. The very fabric that holds a community together just begins to fray. But here's the thing. The analysis doesn't just leave us in despair, and this is so important. It pivots to what we can actually do about it. The source dedicates a lot of focus to forging a path forward, outlining concrete ways this destructive cycle can be broken. So, the crucial point here is that the solutions have to directly address the root causes. You can't just put a Band-Aid on it. This draws a straight line from the problems to the fixes. For poverty, the solution is economic empowerment. For family breakdown, you need family-centric policies. And to counter policy failures, it calls for collaborative government efforts. It's a logical, targeted approach.
But, and this is a huge but, no single solution is going to work in a vacuum. The source makes that very clear. It requires a multifaceted approach. You need action from every level. You need community initiatives on the ground, coordinated government efforts, widespread education, real economic empowerment, and of course, the crucial integration of mental health services. Every single piece is essential.
And all of this brings us to the conclusion of the source material. But it's framed not really as an ending, but as a beginning. It's a collective call to action, emphasizing that rebuilding communities can only happen when everyone works together. This call to action is broken down into these 5 clear, powerful directives. Strengthen families, foster economic growth, promote healthy lifestyles, support addiction recovery, and through it all, rebuild South African townships. These are basically the pillars on which a new future can be built. Ultimately, what this document does is lay out a comprehensive roadmap. It diagnoses the illness, and it prescribes the cure. But it ends with this challenge that just kind of hangs in the air. A question for all of us, really. The plan exists, the path is there, so the real question is, who will answer the call?